Do you know that more doctors lose patients not because they're not competent, but because they don't have a good relationship with their patients? What does that mean? They don't connect with the patient. They don't connect with the patient because they're talking from here and the patient's here. The doctor becomes an authority figure. Now, of course, we are authority figures. We have a lot of knowledge, which patients don't have, but we really shouldn't have more authority than they have because it's not our bodies that are being treated, it's their bodies. So when I talk to a patient, I'm talking to a patient from an informative perspective. Let me back up a little bit. In Atal Gawande's book, Being Mortal, he talks about 3 different types of patients. Now, you may know Atal Gawande from reading the Checklist Manifesto, which is sort of a Bible in our office. We've talked about that in previous videos. But in Being Mortal, Atal Gawande talks about an experience he had with his father. Now, Atal is a Harvard-trained surgeon. His father was also a surgeon. He was an ENT. And his father ended up having cancer. So here we have a doctor having cancer, and his son's a doctor who was helped managing his care, but the son wasn't his doctor. When a relative has a medical problem and you're in a medical profession, oftentimes we're marginalized because we're a family member. I know that from my own experience with my mom. My mom died of cancer 30 years ago, and she was given chemotherapy when she only had 4 months to live. Well, because of the chemotherapy and the reaction to it, she died 2 weeks after getting chemotherapy. And those last 2 weeks of her life were not pleasant. She lost her hair, she was sick, and she died of an embolism. Was she told that she was going to lose her hair and get sick and perhaps die of an embolism? She wasn't. Nor was my dad, who was sort of her caregiver at that time. I knew that that might be a chance being in the medical field, but my family didn't. And because of my younger age at the time, I really didn't have the power or authority to tell my dad what to do. And he wanted to do everything possible to keep her alive. However, those last few weeks of her life were terrible. They weren't pleasant at all. Our patients don't know the pros, the cons, oftentimes of treatment. In the 3 types of relationships that Atal Gawande talks about, number 1, the paternalistic, where the doctor's the authority and the patient is like a child. This is what you got to do. Well, patients are not children. They have their own agency, especially today. Almost nobody listens to the doctor anymore. That's changed because of the internet. Everybody's an authority. You all know that. Patients come in and they start reading books and they say, what about this? What about this? I had a patient the other day that was already scheduled for treatment, and the patient asked me so many questions that they had so many questions reading in the internet that they weren't an authority, but they didn't trust any doctors because they didn't have enough information. So I told the patient, let's take a break. Do your more research. Come back and let's talk in a few months after you know some more research, because that patient wasn't ready. Certainly wasn't going to listen to me. He was trying to become his own authority, which you can become to an extent as a patient, but you will never know as much as the doctor. So if you're not going to listen to the doctor, what do? You make your decision based upon sometimes the wrong information. And unfortunately, that's where we are today in medicine and certainly in dentistry. It's more of a retail relationship. So first relationship is the paternalistic, which doesn't really exist much anymore. The second relationship is the informative. That's a retail information exchange where we give the patient information. The patient takes it in at their level, which is not the level of a doctor. They didn't go to medical school. They didn't do a residency. They don't have 30 or 40 years of experience. They have almost no experience in there. I've yet to have a patient come into my office that knows more about dentistry than I do, because they're not dentists. They're not surgeons. They haven't gone through the training or the experience that I have, unless they're another periodontist that comes in, which hopefully doesn't happen too often. So that patient will come in there with a certain level of knowledge, and we're going to give them information they may or may not be able to understand. And you know, patients only hear 3 to 4% of what we say. They get a feeling, and they're going to make a decision based upon their feeling, which may not be the right decision for them. An example, patient comes in for some treatment. The treatment's $20,000. It's the right treatment for the patient, but they only hear $20,000. So they go, I'm not going to spend that. They want to do it for X dollars. Or this treatment is going to take us 6 months. They want it done overnight because they heard about that on TV. Or they don't want to go through any pain or suffering. They don't want to go through any surgery. I want to handle it non-surgically. So they do it non-surgically where they need the surgery and they get worse. And then they end up needing surgery that's not really that effective a few years later. We've all seen this. So sometimes patients make the wrong decisions because they don't have the right information because they didn't connect with the doctor. So what's the solution? This solution was determined years ago. The Greeks during their times of philosophy, Socrates, Aristotle, Plato, all talked about this. But probably the most famous dentist, or the most famous dentist that most people don't know, is a guy named Bob Barkley. He talked about shared decision making. Atal Gawande, in his book Being Mortal, talks about interpretive decision making, where we share the decision, but we're able to develop a relationship with the patient, so we're able to bring them from here up to here, that we can have a conversation where they understand it. It makes sense. We tell them the costs, the risks, the benefits of treatment, everything. We can do this for you. It's going to cost this much. It'll take this much time. There'll be this much surgery. The aesthetics will look like this. The prognosis short-term will be here. The long-term prognosis will be here. Or we can do it this way. Do we take out the tooth and do a bridge? Do we sieve the tooth and do crown length and do endo? Do we take out the tooth and do an implant? Do you need a sinus graft? All those things are discussed with the patient without any prejudice, because I really don't care what a patient does. I'm going to say that again. I don't care what a patient does. No, I'm not insensitive. What do I care about? I care that the patient will understand what the costs, the risks, and the benefits of treatment are. That's my responsibility as a doctor. Not to do the doctoring, but to first do the education, because it's all based upon education of the patient. So, when you go back to your practices tomorrow, think about, what type of doctor am I? Am I a doctor that's the authority figure, tells the patient what to do, and if they don't want to do it, they leave? I see those patients every day in my practice. Those are the ones that come in for a second opinion. Or are you the doctor that says, hey, it's up to you, whatever you want to do? And you know the patient doesn't have the information, but you manipulate the patient perhaps by scaring them. Or maybe you lower your fee and do what you don't think is right, but what you think the patient's going to accept. And then that's the wrong decision for the patient. It's not my business how much it costs. It's not my business what the patient will accept. What's my business? My business is to have a very well-educated patient so they can make the right decision for themselves. Once I do that for the patient, I know I've done the right thing. And guess what? 90% of my patients say yes to the right type of treatment, independent of the time, the cost, pain and suffering, et cetera, they have to go through, because they want something that's going to last. And when my patient comes back to see me routinely in my hygiene room, I don't want to treat him again. What does that mean? I want to get him to stay healthy. I don't want to retreat. I don't want residuals from my patient. I want to treat him once, get him into the hygiene room, and maintain him. So that's the type of doctor I try to be, the type of doctor that Bob Barkley was, the type of doctor that Atal Gawande is, the one that's able to inform the patient so that I can continue to be the gift to those I serve. Have a great day, everybody.